I'm worried that most of us still think about empathy as a soft skill, a nice to have at the office if you have time. But that has to stop. Empathy is not a soft skill, and it shouldn't be optional in any profession, especially in healthcare. We know empathy is grounded in neuroscience, can be learned and taught, guides design in some of the most successful businesses today, and has medical impact, can shorten duration of the common cold, lower blood pressure, and associated with better outcomes in patients with diabetes. I define empathy as imagining and at times feeling what another person feels and then doing something about it. Imagine what it can do when fully operationalized. Let's do the hard work of listening to the emotional experiences of our patients and our own people, and then bake caring fixes back into every single part of the healthcare system. That would require, though, that we stop thinking of empathy as some sort of magical, elusive, cute, soft unicorn, and start thinking about empathy, both the fixes and how we implement them, as something more fierce, more powerful, like a bull. Yeah, bull. I am a nerdy, neurotic neurologist. I have fully embraced my left and my right brain, which brought me to the job of a lifetime. I'm the Chief Experience Officer at the Cleveland Clinic, which means I read thousands of complaint letters, patient comments, and we work to design a system that cares. And it comes down to this. Across the globe, patients are just trying to survive, not just the disease that brought them there, but the healthcare system itself. And what's worse, doctors and nurses are trying to survive it too. There's a ton we could do to fix healthcare. I submit to you the major experience pain points should help guide our focus. Waits, communication, and burnout. It's my hope as we talk today that you don't ever call empathy a soft skill again. Let's talk waits. Bottom line, people are waiting too much. In 2017, there was a study looking at patients trying to get a general medical appointment, and they found patients are waiting on average 24 days. And if you are looking for a specialist in a major city, it's 70+ days. Now, I want you to imagine you feel for the first time a lump in your breast. Your wife or your partner does. And you're told the first time you can be seen is in 2.5 months. And then when you get there, you'll wait again, anywhere from 7 to 93 minutes in the waiting room. And at least we manage your expectations. You'll be waiting in the waiting room. And then you'll wait again when you go to schedule your next appointment or find out your test results. Being a patient shouldn't mean you actually have to be patient. Have you ever had a secretary tell you that she's going to put you on a waiting list and you're pretty sure no one's going to check that? Or a doctor's office calling the waiting room a lounge? That's fluff stuff. We wanted big changes. So where I work, we rolled out same-day, in-person appointments across the enterprise. We didn't tell people how to do it, we just told them that was the goal. We made access anytime, anywhere. You could access your doctors and nurses on your mobile device 24/7 with virtual visits. And we set a time to treat cancer, not time to appointment, for under 20 days. Big fixes. And patients love these methods of access. 1.3 million patients take advantage of same-day appointments. And if you ask them to rank satisfaction with these visits, it's 2 to 3 times higher what it is in a traditional method. When the wait is over, truly over, empathy will be operationalized. Let's talk communication, fabric of connection. Getting communication right in any field can be difficult, but in healthcare, ineffective communication can be deadly. Medical error, malpractice suits, patient safety, emotional harm, physical harm, fractures of patient trust are all consequences of communication gone wrong. Many clinicians think they are spectacular communicators. And in business, they call that unconscious incompetence. The only way to cure unconscious incompetence is to bring the blind spot to the light. We did this by posting publicly what patients say about our ability to communicate online. And it was not popular. And yet it was necessary. I mean, I wouldn't show up for a class on how to communicate if I think all my patients love me. And sure enough, and we weren't the first. University of Utah was one of the first to do this, and then others jumped in. And sure enough, those spectacular communicators came looking for help. And when they do, you have a responsibility to provide them with training to improve. What we didn't want to do was to get a bunch of med students in a room, tell them to be nicer to patients, smile, thank them. That's not going to do it. We created full-day, evidence-based programming that honored how difficult it is to be a clinician today and used teaching methods they'd never seen before to get them fully engaged. And it wasn't so much how we built the course, it's how we implemented it that was bold. We recruited senior, influential surgeons to facilitate the training, not a bunch of women in flowery dresses. We made it mandatory for staff physicians to participate. We asked malpractice insurers to lower malpractice rates for those that went to the course, and they did. And we built it into onboarding training and made it part of their annual professional reviews. The impact? Well, patients who were blinded to who got the training and who didn't felt more cared for, more respected, better known. Information landed differently on them. And the clinicians who went through the training, we studied about 1,500 of them. Validated scores on empathy scales jumped up, and burnout across the board decreased. Specifically, emotional exhaustion, that feeling that you cannot go on, your bucket is empty, decreased by about 15%. So empathy up, burnout down. Other organizations have trained communication skills, but this assertive, determined, strategic how is what gets empathy baked in and operationalized at scale. Let's talk burnout. I want you to look through the lens of a clinician for a moment. In a 2014 survey of US physicians, 54% of them are burned out. That's up about 10% from 3 years prior. And just for context, in the general population, burnout rates are 28%. Over-regulation, loss of autonomy, sheer speed of information and technology, requirements for documentation to get reimbursed, mean I'm spending all my time in the computer, not connecting with patients. Those are the drivers of burnout. So doctors and nurses are giving less and less time to connecting with their patients. They're hardly making eye contact. And keep in mind, humans are wired to connect. You're neurologically wired. So same part of my brain lights up when I'm in pain as when you're in pain. That's a functional MRI fact. So that loss of connection equals loss of meaning, equals burnout. And for so many, connecting with another is why we went into healthcare in the first place. So I'm being crystal clear. We took human beings who want to connect with other people, wired that way, who chose the profession of healthcare to heal and connect, and then we transformed them into typists, data entry specialists. We've stripped them of their humanity. In part because of that, people are leaving the profession. It's a serious problem. And the turnover costs of that are in the millions. And to bring it home, a comprehensive review looking at comparison to the general population, 40% of male physicians are more likely to commit suicide. And female physicians, 130%. As a neurologist and a human being, this rips me at my core. So sometimes we're told to go to yoga or art therapy or breathe. These solutions are the anti-empathy. They drive me nuts. I am resilient, just by sheer fact of what we went through to become clinicians. Makes us resilient. So these solutions ignore the systemic drivers of burnout. Like many others, Atrius Health realized that people were spending too much time in the computer. So they automated refills, triaged messages, and created widescreen displays. They reduced clicks by 1.7 million. We've experimented with other people doing the documentation and smarter notes, and as a result, have reduced time spent at home in your computer after hours by 70%. That's time back to your family. Mayo Clinic, pains me to say, had a great idea. It's a compliment. They did a randomized control trial where they gave clinicians time to use as they chose and time to foster relationships with each other and talk about meaning in their work. The intervention group, a year later, had significant reductions in burnout. To top it off, their CEO put reducing burnout on his scorecard to the trustees. These fixes are not small, they're not fluffy, they're not cute. They're big and bold. This broken healthcare system is making people sick. We got to get it right. To get to a healthcare of the future that is seamless, cohesive, customized, caring, and high touch, you are going to need to transform the human experience into something much more humane. And to do that, you're going to need to take that fluffy, soft thing, that unicorn, and transform it into a raging bull. Empathy operationalized. Thank you.